Hello everyone, my name is Dr. Ferox and I'd like to talk to you about ear infections in dogs, although the same principles do apply to cats as well. Ear infections in dogs are very common. We see them all the time, and they can be very frustrating to get under control. A typical dog with an ear infection will often have sore ears, red ears, they shake their head a lot, and they often have this sort of thick, dark discharge coming out of their ears, which can look almost like Vegemite. And it can smell like Vegemite as well. Now, the discharge often looks the same, but it can be caused by multiple different organisms. We often see yeast infections in dog ears, and they look like happy little snowmen under the microscope. But we can also get bacterial infections. Bacteria we either classify as being cockeye-shaped, which are the little dots, or rod-shaped, which are the little rods. Now, the rod-shaped bacteria are often bad news in a dog's ear because they are the ones that are most often drug resistant, and they can be multiple drug resistant. And you don't know which drugs they're resistant to unless you take a sample and ship it off to the lab. When we get a dog with an ear infection in, we will typically do an otoscopic exam that lets us look all the way down the canal to check out the eardrum. We do this to make sure that the eardrum is actually intact, because some drugs will be very dangerous for the dog if the eardrum is not intact, but also to make sure there's no foreign objects stuck in the canal, especially grass seeds. Because if you treat an infection, but you don't remove the cause of the infection, you're just going to get another infection, and that will drive everybody nuts. Now, once we've prescribed medication, we will often say to treat for X many days. We don't say that for funsies. Those rechecks are actually important, even if the ear looks good. Because unless you have an otoscope lying around, if the external ear looks okay, you still can't tell me what's going on deeper in the canal. And if that infection is still there, it's just going to come straight back as soon as you stop treating. When this happens, owners often think that the medication hasn't worked, when really it probably has worked, it just needed a much longer course. But we don't know unless we get to look. Now, if you stop treatment without coming in for a recheck, you run the risk of antibiotic resistance. If this is our population of bacteria inside the dog's ear, there's lots and lots and lots of them, and the antibiotic might be 95% effective. But the ones that die off last are going to be the resistant ones to that antibiotic. In this case, the red ones. So when you stop treatment, even if you've killed off a whole bunch of bacteria, they're going to start multiplying again. You're going to have more and more of that population be resistant to the drug. So maybe you have antibiotics left over, which you shouldn't, and you decide to treat again. And it comes back again. And maybe you do it just one more time. And soon enough, you're going to have a population of bacteria that is completely resistant to that antibiotic. And then you're in a whole world of pain. Even yeast infections, our happy little snowman friends, sometimes require prolonged treatment in order to get all of the canal under control. Without our rechecks, we end up with dogs that have recurrent, complicated infections, which drives everyone mad. You, me, and the dog. Ear cleaners can help control the microclimate in the canal, but there are no home remedies that I recommend for this purpose. Now, a flopped over ear will trap more moisture at the ear canal than an upright ear. This varies with how extreme that flop is and how hairy the ears are. Cropping was traditionally claimed to prevent ear infections in dogs, but there is no significant health benefit to doing so. We crop dog ears for aesthetics only, and we shouldn't. If ear cropping was truly done for the health of the dogs, then why don't we see more Cocker Spaniels with cropped ears? The relatively benign, normal and healthy ears of the natural cropped breeds are generally not a problem. So remember to go to your recheck appointments. They're here to save you, us, and your dog a huge headache down the track. My name is Dr. Ferox, and I'll see you next time.